Hello, I'm Dr. Shazia Yunus, Family Medicine Specialist from Ahalia Hospital Hamdan, Street, Abu Dhabi. As we know that January is a month of thyroid awareness and cervical cancer screening awareness, so I will be talking about both in brief. First, let us start with the thyroid problems. Thyroid is a butterfly-shaped gland which is located in the neck, and it produces two major hormones, which is triiodothyronine or T3 and thyroxine or T4. These two hormones are under the control of thyroid stimulating hormone or TSH. We have 5 types of thyroid problems, but I'll be discussing about the 2 major problems. The first one is hypothyroidism, in which the thyroid gland produces less hormones, thus resulting in a low metabolic rate. And the common symptoms would be tiredness, lethargy, generalized muscle weakness, weight gain, puffy face, constipation, sleep disorders such as excess sleeping, menstrual disorders, and it's more common in women. Whereas another condition is the hyperthyroidism. It's totally opposite of hypothyroidism. In this, the gland produces too much of hormones, thus resulting in too active metabolism. And so the common symptoms are irritability, nervousness, and anxiety, intolerance to heat, like more sweating, diarrhea, weight loss in spite of the normal diet, and this is more common in males. Now, how do we diagnose and treat? Diagnosis is done by a simple lab test, which are the thyroid function test, and there are some other tests for the antibodies and so on. Treatment is very simple, just one single tablet for lifelong if it's genetic or autoimmune. Sometimes, if there is any inflammation of the thyroid, the treatment might be temporary, and then there are some other treatments as well. People think that thyroid disease is not as important as heart disease or diabetes, but if it's undiagnosed and untreated, may lead to serious cardiac complications, infertility, and osteoporosis. So it's very important for these 2 conditions to be treated. We are having some promotions, and we are offering a free consultation in our family medicine departments. So kindly do visit us, and we will examine you, we will investigate you and treat you accordingly if you experience any of the symptoms which I mentioned earlier. The second thing which I will be talking about is the cervical cancer screening. We know that cervical cancer is the 4th most common cause of death in women. So, and the good thing is that it's 100% preventable. There are 2 things. First is the cervical pap smear, and then second is the vaccination against the HPV infection and cervical cancer. For the cervical pap smear, it's done every 3 years in women aged from 25 years to 49 years, and it's done every 5 years in women aged from 50 years to 65 years. Whereas in women who are immunocompromised and they are on some medication due to chronic diseases, they will be screened annually. For the vaccination, it is started as early as the age of 9 years, but the recommended age is from 11 to 12 years. If the vaccination is started before 15 years, need 2 doses to be fully protected, and if it started after 15 years, need 3 doses to be fully protected. Whereas the adult women with the age of 25 years and above, the vaccine is not recommended, as most of them have been exposed to the virus already. So please do consult your family physician, visit our family medicine department, and we would guide you about the vaccination and refer you to the gynecologist for the cervical pap smear. Take care of yourself, and thank you.